Hello, my name is Philomary Jones. Today I'm doing a patient case presentation video. Okay, so chief complaint. My patient JJ presents to the clinic reporting that she thinks people are following her. History of present illness. She's a 30-year-old African American who presented with complaints of being followed by unknown individuals. Her husband reported that she locked herself in a closet and screamed for approximately 1 hour due to fear that others were trying to harm her. So this patient appeared distressed and maintained a firm belief that others were watching or following her despite of reassurance. So this onset and duration of symptoms should be further clarified, including any precipitating stresses and recent life events. So the patent positives, the presence of auditory and visual hallucinations, that's number one, and the patient has sleep disturbances. Substance use history. She denies using any drugs or taking alcohol. And then previous psychiatric episodes, there's none. She's medication adherence, there's none because she has not been taking any medications. So history of trauma, she denies any trauma at all. Previous psych history, it's unknown, needs further evaluation on that. And then medication history is unknown because she doesn't take any medications. So medication history unknown as well. Family psych history, mother had a history of anxiety disorder while the father had schizophrenia. So when we try to review the systems, psychiatric are positive for paranoia and possible delusional thinking, positive for behavior disturbances, and reports hallucinations, denies suicidal ideations. Neurologically, she denies any headaches, seizures, or focal deficits. And constitutional, she reports sleep changes and appetite changes. When we do the physical examinations, she appeared a little bit of anxious, fearful, and agitated. Mental status examination, Varela Tonorenti times 6. She is appropriate. Appearance, patient was distressed and guarded with agitated behavior. So the patient had anxious mood and liable effect. So her thought process was a little bit disorganized and impaired judgment on this. So recommendation from my preceptor, Dr. Obi, moving forward. So she would recommend immediate safety assessment for risk of harm to herself and others. She would consider psychiatric hospitalization if the patient is unable to care for herself or poses a safety risk comprehension medical evaluation to rule out organic causes or psychosis. So we'll initiate antipsychotic treatment if clinically indicated and arrange close psych follow-up and interdisciplinary care. Thank you so much.